I thought I'd briefly review some of the FDA's current policies and initiatives that threaten health freedom and remind you why DSHEA is so important to your health freedom and why it's so much of a threat to the FDA, the agency that runs the U.S. Codex activities. FDA Codex are two sides of the same regulatory coin, if you will. Today we're talking about FDA and Codex, but bear in mind that everything we're talking about, the dangers FDA and its international partner Codex, is equally true of the dangers USDA, the U.S. Department of Agriculture, which allows the EPA, which is trying to ban that very safe natural substance, nanosilver. You know, we were talking about agencies with lots of alphabet names, but they're still the same government with the same policy. We want our rights. We want our health. We want our food. And we want our health freedom. We want the U.S. government out of the business of misregulating food. Food regulation must become the province of the marketplace and the states, which are closer to the people and more accessible to our impact and control, except maybe in New Jersey. DSHEA says that supplements and herbs are to be considered as food. They're deemed to be safe when used as directed. Because they're food, there can be no limitation on dose, leaving the door open to the high-potency supplements we all enjoy uniquely here in the United States. Protected ingredients are defined as those items available for sale and use in the dietary supplements before June of 1994, when DSHEA went into effect. A list of the grandfathered substances was compiled back then by the National Natural Food Association, now called the Natural Products Association. And it's been accepted by the FDA for many years. It defines what are these DSHEA protected ingredients that can be sold as dietary supplements. And it's been the core of health freedom as it pertains to supplements in the U.S. since the law was passed. The FDA is now unilaterally denying the fact that this list is good evidence of what substances are protected under DSHEA. The agency is acting to continue and accelerate the process of destroying access to high-potency supplements upon which so many of our natural health options rely. And here's the process the FDA is following. First, in 2007, as I mentioned earlier, Congress rewarded the FDA for its failures by increasing its power. This was done through Senator Kennedy's FDA Enabling Act. Although your vigorous efforts, and I thank you, did get the DSHEA Product Savings Clause, which is Section 1011, added to that bill. This important clause specifically exempts all DSHEA products from any provision in that bill. Well, second, in 2008, the FDA asks for public comments on how the DSHEA Product Savings Clause applies to another section in that bill, Section 30111 of the Act, which gives the FDA authority to ban foods that are being studied for use as treatment of disease, because, of course, those foods then become drugs. The simple legal answer is, of course, there is no connection between that new FDA power and our DSHEA products. That's because the law is very clear that clause was added. And again, our valiant mouse warriors took to the challenge and clipped in large numbers to tell the FDA that we value both the rule of law and the protection of this bill for our DSHEA products. Third, last month, a prior citizen's petition from a pharmaceutical company was used by the FDA as the excuse to ban a specific form of vitamin B6, pyridoxine, negating the critically important 1994 NMFA grandfather list of dietary supplements. This was the act when they basically said, we're no longer going to look at that list. We want to see real proof that it was sold. Show us invoices. Show us proof that that ingredient was being sold in 1994. Of course, most companies that are selling ingredients today didn't exist in 94, and most records from 94 of that nature don't exist anymore either. So, basically, they have now put all dietary supplements at risk to be banned. Fourth, in Europe, the European Food and Dietary Supplements Agency met to discuss what are called maximum permitted levels, MPLs, of nutrients. Again, I repeat, nutrients are foods. Foods are safe when used as directed. They don't have any upper limits. The imposition of upper limits is a direct threat to our high-potency supplements. Fifth, based on yet another one of those citizens' petitions, from favored consumer groups. The Environmental Protection Agency, as I said, is expressing a possible ban on topical nano-silver products as pesticides, despite the fact that silver has already been approved as an inexpensive and highly effective surface cleaner by the very EPA itself. And of course, if nano-silver is treated as an unapproved pesticide, what do you think will happen to silver as a supplement? To nano-silver supplements, which are the only truly non-carcinogen, non-toxic antibiotic available to people today. Sixth, the FDA seeks to eliminate all nutrients and objects from health which use or have any study about them published of any sort whatsoever. This is the ultimate import of that dangerous clause 301. You know, well, I'll get onto that later. Sixth, seventh, both the FDA and Codex are seeking to eliminate all nutrients which have not met an artificially high, what they call significant scientific agreement standard of proof. That violates DSHEA's requirement, which only requires what we call the commercially reasonable, competent and reliable scientific evidence level of proof. Dr. Ron Paul has a bill introduced that would protect us from that change. And of course, a number of people in Congress are beginning to understand the threat that a little change in the standard of evidence can really make. And so the beat and the beating goes on. But let's go back to paradoxically. FDA's response, as I noted above, to the position that DSHEA protects dietary supplements from the unfair tactic of some pharmaceutical company conducting a so-called study of the ingredient for medical use and then using that study to ban that very competing natural substance was thrown down as a gauntlet at the feet of the industry, and a ban of a legal grandfather nutrient supplement was imposed for that very reason. A pharmaceutical company claiming to be a citizen petitioned the government, and the government responded. It's our opinion that when we, health freedom advocates, industry, and the consumers of the United States together, we need to protect our access to high-potency supplements. It's also our opinion that we have to engage in a concerted campaign to divest the FDA and the USDA, etc., of food regulatory authority. Congress has, at least 3 times before, divested the FDA of authority that it was misusing or failing to exercise well enough. When the DEA was created and the power over controlled dangerous substances was taken from the FDA, when the EPA was created, and when the Consumer Products Administration was created. How much more FDA misregulation can consumers and the industry survive? How much more FDA misregulation will consumers tolerate? Are you ready to act? Back a year or so ago, there was a government study of the FDA itself, and it called it a failed agency, and listed 12 areas in which it was failed. Now, of course, as I said, Congress's response to the failure of the FDA was to give the FDA more power to abuse. My answer to the question of what is the impact of Codex, the World Food Code, on our health freedom is this. That depends on the FDA. It depends on the USDA and the other alphabet agencies. It depends on Barack Hussein Obama. But most of all, it depends on us. So there we have it. Either the FDA is divested of food authority, or we will, bit by bit, and then larger bit by larger bit, lose our access to high-potency advanced nutrition. I'd like to thank you all for coming here today. It is democracy in action, such as this event today, that will make real change possible. And please check YouTube/Natural Solutions, youtube.com/Natural Solutions, in a couple of days for some videos of this event. By coming here today, you've all shown that you are the grassroots of health freedom. By going to www.healthfreedomusa.org and joining our free Health Freedom Action e-alert list, you will become the net roots of change. Thank you.